Okay. So the client has been seeing you for 6 weeks, and you feel that they need to go on, and they don't want to come anymore. How does that work?
Or vice versa.
Or vice versa, right. Or, you want to stop them from coming. You say, you're fine now. How does that go?
Well, I've never really kicked anybody out, outright. But what happens initially is, like I said, there's an evaluation process that involves what brought the person into therapy in the first place. And usually, it takes a few sessions to get the whole history, or at least enough to be kind of make the situation and then relationship solidify. And then there's treatment goals. So hopefully the goals of the therapist and the client are the same, because it would be really, I think it would not be advantageous if a therapist had goals for the client that the client didn't want to get out of the sessions. So they come together and figure out, this is what the client came in wanting to work on. And then the therapist can say, this is what I see going on, and here's where I see it going. Let's set some goals. And then after a certain amount of sessions, you can come back together and say, where do you think we're at? And so hopefully the process of, I think we've met some of these goals. Are there other goals we can meet? Are there other things that have come out of this work that we can work on in the future? Hopefully, if you're doing it right, it kind of defines itself. But sometimes I think you have to sort of take out the notes again and say, wait, you said this is where I'd be, and I'm there. And
Okay, well, my next question is about confidentiality. Okay.
It's a biggie.
You have a teen who comes in, their mother's paying. What is the level of confidentiality? What, the mom wants to know what's going on
What
in there.
would you want to know?
Like as the person who's paying, as the parent,
Right.
they're gonna step out of the room and you're gonna say, what did you find out? What's happening? Like, how does that work?
That's such a difficult situation to balance as a clinician, because if you have teenage clients or and their parents, obviously there's a relationship there between who's the adult and who's paying the bill, but also as an adult we know that there's things that adults need to be keyed into. But there's also a relationship to be built with this teenager, and they're not going to tell the therapist things if they think everything is being funneled back to the parent. There are some laws, baseline laws that are set in place in terms of confidentiality. If somebody's going to hurt themselves or somebody else, confidentiality has to be broken. And that's just from the get-go. Now, does that mean that if somebody comes in and people are always nervous to say to a therapist things like, oh, I could just kill that person? Does the therapist then have to call the authorities? There's a difference.
I mean, some people, you say that driving down the road. Like, I not really. But I mean, like in general, like just coming out and saying, oh, I could just kill them. Nobody, like, how do you determine whether that's real or not? That's
the job of the clinician. That's where you have to trust that there's a difference between off-the-cuff sayings and somebody who has had the training to figure out when confidentiality has to be broken. When it comes to teenagers, different people have different rules. There's the law, and then there's the clinical practice and how they operate. And it's tricky. And for me, I tend to tell teenagers most of the things that their parents tell me about them.
So, okay, if you have a teenager that's come in, do you maybe have a private session with their parents separately or with them together?
It's actually an exceptional question. When I get a referral for a teenager as a client, I have a conversation usually with the parent who's calling to make the appointment, and then we decide what the best way to progress is. Sometimes, and it's my preference, honestly, I would say if they are a willing party, I'd like to meet with them first And I always tell them that I'm going to meet with your parent, and we're going to set up, we usually set up a session later that week, very shortly thereafter. But I don't think you'll be comfortable as a teenager to come in knowing that my parent just met with this person who I don't know and I've never met and told them everything about me. So I tend to like to give them the upper hand.
Or you like to give?
The teenager. That's my preference.
Okay. And I actually just have one last question about group therapy. What do you think of group therapy?
I think that group therapy can be very interesting and very powerful. I think that it depends on the composition of the group. If it's a homogeneous or heterogeneous group, meaning like if this is a group of people who are all there because they have a substance abuse issue and can help each other, that could be really powerful and really helpful. I think that if you have one adult man and a teenage girl, and a woman who's struggling with their career choices coming together to do group, it would be pretty tricky to put, it's possible, but it'd be pretty tricky to make that manageable. And I think it'd be hard as a clinician to manage that, but it's possible.
Well, Dr. Acey, thank you very much. I'm really feeling in the groove after that conversation. We will see you later. Tractor, yes, I'm on groove. Tractor, yes, I'm on groove. Tractor, yes, I'm on groove. Yes, I'm on groove and tractor.
Do you know that stroke targets by color? If you're African American, you're twice as likely to suffer a stroke as white Americans. Join the power to end stroke at strokeassociation.org.
If a natural disaster happened, we'd probably all meet around the grocery store.
We would all meet at a bus stop.
We'd probably meet at our neighbor's house.